Friends, today we continue our discussion of the signals your body gives at night. These symptoms are often written off as nerves, allergies, or just age, but the truth is that many of them are directly linked to diabetes and high glucose levels. I want you to recognize these clues from your body and not ignore them. Symptom 7. Burning and numbness of the feet, diabetic neuropathy. Why it occurs? With chronic hyperglycemia, glucose damages small nerves, especially in the feet. As a result, burning, tingling, or pins and needles sensations appear at night. Statistics. The Lancet Diabetes and Endocrinology, 2019. Up to 50% of patients with diabetes longer than 10 years suffer from neuropathy. Danger. If left untreated, this leads to diabetic foot syndrome, ulcers, and even risk of amputation. How to distinguish? In osteochondrosis or spine issues, pain is stronger during the day and depends on posture. In diabetes, the discomfort is worse at night even when resting. What to do? Keep glucose within target levels. Inspect feet daily for skin changes. Discuss nerve protective therapies with your doctor. Alpha lipoic acid, B vitamins. Symptom 8. Itchy skin, especially in the intimate area. Why it occurs? High glucose creates a favorable environment for fungi and bacteria. This problem is particularly common in women. Statistics, BMJ 2018. About 30% of patients with poorly controlled diabetes report recurrent nighttime itching. Danger: fungal infections, urinary tract infections, chronic inflammation. How to distinguish? Allergies usually cause itching with a rash. With diabetes, itching occurs regularly without rash and worsens at night. What to do? Stabilize glucose. Wear cotton underwear. Treat infections as prescribed by your doctor. Symptom 9. Morning headaches. Why it occurs? They can result from nocturnal hypoglycemia, especially in patients on insulin, or the dawn phenomenon, when stress hormones raise glucose at 5 to 7 a.m. Statistics, Cleveland Clinic, 2020. About 25% of diabetics regularly wake up with headaches. Danger: such episodes increase stroke risk and impair cognitive function. How to distinguish? Migraines may occur any time of day. With diabetes, the headaches appear mainly in the morning and often improve after breakfast. What to do? Check glucose before bedtime, at 3 a.m., and in the morning. Discuss medication timing and doses with your doctor. Avoid late carbohydrate-heavy dinners. Symptom 10. Fog in the head in the morning. Why it occurs? Glucose fluctuations during the night disturb brain function. A person wakes up with the feeling of not having slept at all. Statistics. Harvard Health 2020. 30-35% of patients with diabetes report morning weakness and cognitive clouding. Danger: reduced attention, increased risk of accidents, accelerated brain aging. How to distinguish? With simple sleep deprivation, fatigue persists all day. With diabetes, the fog is strongest in the morning and may improve after eating. What to do? Have a light dinner without sweets. Add 20-30 minutes of evening walking. Monitor glucose in the evening and morning. Symptom 11. Dry, cracked lips and tongue. Why it occurs? In hyperglycemia, the kidneys remove excess glucose along with water, leading to dehydration and dryness of mucous membranes. Statistics, American Diabetes Association 2019. 40% of patients with high nighttime and morning glucose show dry lips and tongue. Danger: risk of dental infections, gum inflammation, bad breath. How to distinguish? In winter, dryness is common for everyone. With diabetes, dryness persists even in warm seasons and is present at night and in the morning. What to do? Drink water evenly throughout the day, not in large amounts at night. Avoid sweet beverages. Control glucose levels. Symptom 12. Nighttime joint stiffness and thirst. Why it occurs? In diabetes, dehydration aggravates joint inflammation. Glucose damages collagen, making ligaments and joints less flexible. Statistics. Mayo Clinic, 2018. About 20% of patients with diabetes complain of nighttime or morning joint stiffness. Danger: development of diabetic arthropathy, contractures, reduced mobility. How to distinguish? In arthritis, stiffness improves during the day with movement. In diabetes, stiffness is worse at night and in the morning, often combined with thirst and dryness. What to do? Control glucose. Maintain a healthy weight. Add gentle joint exercises such as stretching or yoga. Conclusion. Friends, we have discussed the next 6 nighttime symptoms: neuropathy, nighttime itching, morning headaches, brain fog, dry lips, and joint stiffness. These signals must not be ignored. They mean high glucose is damaging your nerves, vessels, and joints. I guarantee if you stabilize glucose, correct your dinner, and add light evening activity, you will feel relief and improve sleep within a few weeks. Now, my question to you, which of these symptoms have you noticed most often? Burning feet, headaches, or dry lips?